Hi friends, I am Dr. Pratap Singh. I have done MD in Forensic Medicine. In today's video, we'll start with agricultural poisoning. In that, we'll mainly discuss about organophosphorus poisons, which are the commonest poisons used for suicidal purposes. Agricultural compounds, there are more than 1,000 chemicals which are used for purpose of as insecticide and pesticides, and they are classified based on how much they are toxic to the humans, and as well as how they are origin, whether they are vegetable origin or chemical origin. Coming to classification based on toxicity, first is which are virtually harmless, so which are harmless, not harmless to humans. So in that there is phenolic acid, mainly consists of plant hormones, which are used for dog or thistle controls. There is copper oxides, oxychlorides, used as fungicides, then lime sulfur washers, which are used for orchid fungicides, petroleum washers, tar oil emulsions are used for fungicides or herbicides. Next is comparatively harmless, which are like sulfuric acid, which is used as a weed killer, that is to remove unwanted plants. Sodium chlorate, which is used as a mass herbicide for road and tracks to remove plants. Then mild toxic chlorinated hydrocarbons like DDT, gamma-oxide, methoxychloroquines, dioxins, which are used to kill flies, locusts, and ticks, are also as agricultural insecticides. They are highly toxic. These are very toxic to humans, can cause death of humans. So these are highly toxic compounds. So these are the poisonous compounds which can cause death of humans. These are used for insect purposes. First is in this is arsenic compounds like sodium arsenate, lead and calcium arsenate, Paris green, nicotine sulfate, tannins, used to help for horticultural insecticides. Then there is hydrocyanic acid, potassium cyanide, sodium cyanide, dinitro compounds which includes dinitrophenol, dinitroorthoxazole, which are used as weed killers, herbicides, and insecticides. Then organophosphorus compounds. So polyphosphates are the compounds which are most commonly used, and they are used as insecticides as well as acaricides. Which among them, these are the commonest compounds: HETP, that is hexaethyl tetraphosphate, tetraethyl pyrophosphate, OMP, that is octamethyl pyrophosphoramide, and parathion diethyl nitrophentyl diphosphate. Coming to classification based on the origin, agriculture compounds, insecticide which includes vegetable origin, they are like nicotine, pyrethrins or retinones. Then chemical insecticides, among them inorganic chemicals like phosphorus, compounds of antimony, arsenic, barium, mercury, thallium, zinc, and fluorides. Then synthetic origin, this includes phosphate esters, mainly the organophosphorus compounds. Again, among them there is also aryl groups and alkyl groups phosphates, which are poisonous. Then carbamates, then chlorinated hydrocarbons. Among them there is Indian derivatives like chlordane, heptachlor, aldines, diodines, etc. Then chlorbenzene derivatives like DDT, chlorphenethane, benzene hexachlorides, and chlorinated camphins. These are all synthetic organic chemical insecticides, and among them organophosphorus again are commonly used, and in this video mainly will discuss about that. Coming to organophosphorus poisons, these are esters of phosphoric acids. So these are the compounds which are esters of phosphoric acid. Among there are two groups of compounds. One is alkyl phosphates, one is aryl phosphates. So alkyl phosphates includes hexaethyl tetraphosphate, TPP, OMPA, dimethoxyphosphate, etc. Then among aryl phosphates includes parathion, pyroxenone, methylparathion, chlorothione, etc. They are available as dust, granules, and liquids. So these are mainly used for as insecticides to spray on the plants. So they may be used as a dust or for any like liquid can be used. Coming to absorption of organophosphorus. So organophosphorus compounds are easily absorbed from any part of mucous membrane. So they can be absorbed from inhalation route, from skin, or from gastrointestinal tract. They can be absorbed. They are widely distributed in body and readily cross placenta and can also cause death of fetus. Then they are mixed with a solvent called aromax. Because of that, any person who consumes organophosphorus compounds in their body cavities, they smell like kerosene. So because of aromax, they smell like the body cavities will smell like kerosene. Coming to metabolism, so metabolism occurs in liver. So organophosphorus are metabolized in liver. Detoxification occurs in cytochrome P40 monooxidase enzyme. So cytochrome P40, which is present in liver, acts on the OP compounds to detoxify them. Aryl phosphate, on the other hand, which common example is parathion. So this parathion it requires liver to get activated to become toxic. Excretion of metabolites of organophosphorus compounds is mainly by kidney through urine after detoxified by liver. So liver acts on organic phosphorus compounds and they are excreted in urine. Coming to action. So mechanism of action. To understand mechanism of action, first you should know about the muscular junction. So muscular junction includes the nerve endings and the synapses where it acts mainly like muscle end there may be there. So whenever the nerve is stimulated, they release acetylcholine, ACH is released. They act on the end receptors and stimulate the nerve endings. So stimulation it causes stimulates. So acetylcholine is produced in the myoneural junction and act as a chemical signal transmitter synapses, which is hydrolyzed by choline and acetic acid simultaneously. So cholinesterase enzyme is present in plasma. So cholinesterase enzyme acts on AC, that is acetylcholine. So they to form choline and acetic acid. So this is the normal process of which happens in the myoneural junction. Hydrolysis is greatly increased by cholinesterase enzyme, which are present in plasma on the membranes or within the cytoplasm of many cells. So they are present in plasma membranes, other membranes, and also part of the cytoplasm of membranes. So organophosphorus compounds are powerful inhibitors of this enzyme, that is carboxylic esterase enzyme. So anyway, so whenever there is stimulation occurs, the ACH which is active present, the cholinesterase enzyme acts on ACH, but because of organophosphorus compounds, so organophosphorus compound act on this mechanism and prevents the degraded hydrolysis of ACH. So mainly it acts as a carboxylesterase enzyme, acetylcholinesterase, which is a true cholinesterase found in the red cells. So they are present in the red cells, and also pseudocholinesterase found in the plasma, liver, heart, pancreas, or brains. So organophosphorus inhibits this esterase enzymes so that acetylcholine, which is present in the plasma, continually stimulates the nerve and the muscle endings or any synapses. So organophosphorus compounds bind firmly to esterase enzymes, inactivating it by phosphorylation. So cholinesterase enzyme plus OP is because organophosphorus becomes stabilized by hydrophosphorylation, and it prevents the action of cholinesterase on ACH. So it cannot act on ACH to hydrolyze. So ACH stimulates the nerve endings, continuously stimulates the synapses, synaptic end, so that the signal is continuously stimulated. A portion of enzyme inhibited by the single dose is restored activity within a few hours, but some remains permanently inactivated and can only be replaced by synthesis of new proteins. So cholinesterase enzyme plus organophosphorus compound which is present sometimes are broken, or sometimes they are permanently adhered and cannot be replaced. By only it can be replaced by forming new cholinesterase enzymes. Phosphorylated acetylcholinesterase loses an alkyl group, due to which the enzyme cannot spontaneously hydrolyze the permanently inactivated. So usually the organophosphorus acts and removes the alkyl group in the cholinesterase. So because of that, they cannot act on the acetylcholine. Since ACA is inhibited in all parts of the body, acetylcholine accumulates in the parasympathetic, sympathetic, and somatic sides. So ACH acetylcholine, which is liberated from the neuron end, get accumulated in the nerve ends and continuously stimulates. So there is no cholinesterase enzyme to prevent the hydrolysis of ACH. Because of that, there is continuous stimulation occurs, and continuously the muscle, if it is action on muscles, it continuously contracts. This produces syndrome of overactivity due to unhydrolyzed acetylcholine with continuous stimulation of local receptors and eventually paralysis of nerves and muscles. So this continues throughoutly, and first it causes stimulation, later on then it causes paralysis of muscle. So First, it causes stimulation, then later on, it causes paralysis of that muscle. The inactivation of cholinesterase enzyme becomes irreversible after 24 to 36 hours. So, this inactivation permanently it becomes inactivated after 24 to 36 hours. Symptoms appear in both sympathetic and parasympathetic nervous system. Small repeated exposure may gradually depress the cholinesterase activity to very low levels, often resulting in minimal symptoms. So, if small doses are exposed, like person who sprays the OP compound for chronically, in them the cholesterol activity is very low levels, resulting in minimal symptoms or symptoms are very low. Some factors which influence the symptoms of organophosphorus compounds depends on this balance between the muscarinic symptoms as well as nicotinic receptors. So the receptors how much receptors of muscarinic receptors and how much percentage are present or how much are percentage are activated, based on that the factor depends. Also the how much dose is received, route and rate of absorption also it depends. So assertive symptoms includes rapid falling inhalation and least rapid falling absorption from the skin. Coming to signs and symptoms, they are similar to those resulting from overdoses of astaxanthin, pilocarpine, or fastinine, or muscarine. There are three distinct actions. One is muscarinic symptoms, which resembles prostaglandinic parasympathetic activity. Then nicotinic-like symptoms, stimulation, which includes postganglionic and somatic motor nerves. Then central nervous system is followed by depression. So muscular symptoms are mainly involved into muscles, some glands there includes. Nicotinic symptoms mainly includes like muscles, voluntary muscles are involved, and CNS mainly for in brain activities involved. Involuntary muscles and secretory glands are affected first, then voluntary muscles, finally the vital brain centers. That's how it starts. With massive ingestion or inhalation, symptoms may begin within 5 minutes and may be delayed for up to 1 hour at the maximum up to 2 to 2 years. So it may start as early as 5 minutes or later up to 2 to 8 hours, based on how much the person has consumed or how much he has inhaled. Coming to muscarinic manifestations. So muscarinic manifestation, as I mentioned, these are involuntary muscles involvement. They can be remembered as sludge. So this is one of the popular acronym which can be remembered, which includes salivation, S for salivation, L for lacrimation, U for urination, D for defecation, G for gastrointestinal distress, and E for emesis. So you should remember these are all involuntary muscles, mainly the salivary gland, lacrimal gland. So these muscles are involved. Uh, Involuntary muscles are involved and they are stimulated and causes increased secretions. So in bronchial tree, there is bronchoconstriction occurs, increased bronchial secretions, dyspnea, cyanosis, and pulmonary edema. So in bronchial tree, increased secretion of bronchial muscles causes contractions, secretions, cyanosis. In GIT, it causes anorexia, salivation, nausea, vomiting, cramps, tenesmus, pancreatitis may develop. Salivary gland causes increased sweating, sweaty glands cause increased sweating, salivary gland causes increased salivation, lacrimal causes increased lacrimation. CVS it causes bradycardia, decreased heart rate, tachycardia increase or increased heart rate, arrhythmias or conduction blocks or hypertension. In pupils it may cause meiosis. This is one of the important findings, that is constriction of pupils. So the pupils become constricted, occasionally unicolor, may also become dilated. Ciliary body shows blurred visions, bladder cause urinary incontinence. The person may urinate frequently. Without any provocation, incontinence will be seen. Coming to nicotinic manifestations, these are again muscular, includes the voluntary muscles are involved. So any voluntary muscles, if there it causes, it can be seen. So initially stimulation results in contraction of the muscles, later there is paralysis. So any muscle which is continuously stimulated, it first it causes contractions, later on it becomes, because increased contraction, later on it becomes paralyzed since there is continuous stimulation occurs. Muscle weakness is due to accumulation of acetylcholine. There is fasciculations, cramps, weakness, and areflexia. In sympathetic ganglia, there is hypertension, tachycardia, and pallor, and mydriasis may occur. CNS manifestations includes all the symptoms of CNS, like some symptoms like headache, tremors, anxiety, drowsiness, confusion, slurred speech, ataxia, endless weakness, coma, convulsions, depression, respiratory cardiovascular symptoms. So most of the serious symptoms, CNS symptoms are seen, with depression of respiratory cardiovascular symptoms, which may lead to death of person. In some cases, only muscarinic nicotine symptoms are seen or CNS effects are seen, but in most cases, combination of all the three are present. So, muscarinic symptoms, nicotinic symptoms, and CNS symptoms. So, all three will be present. Sometimes only two will be present. So, muscarinic symptoms are commonest, and it will be commonly seen. Nicotinic effects are seen in only 20% of cases. Mild poisoning. So, based on how much the percentage cholinesterase enzyme activity is present, so symptoms may differ. In mild poisoning, cholinesterase activity is 20 to 50% of normal. So, when 20 to 50% of cholinesterase enzymes activity is present, signs includes nausea, malaise, fatigue, minimum muscular weakness, cramping without diarrhea. Then moderate symptoms when activity is 10 to 20%. So there is sludge, that is salivation, lacrimation, urination, defecation, gastritis, distress, and emesis, tremors, weakness, fasciculation, confusion, lethargy, and anxiety is seen. In severe poisoning, when cholinesterase activity is less than 10% is present, the sludge will be present, that is mechanical symptoms with respiratory insufficiency, weakness, fasciculations, coma, paralysis, and CNS symptoms will be present. In some cases, rarely, so in rare cases, there is peripheral anemia where there is chromolacryuria where shedding of red tears caused because of accumulation of porphyrin in the lacrimal glands, which will be secreted by lacrimal glands. Coming to intermediate syndrome, in some cases, after 1 to 4 days, muscle weakness and paralysis characterized by motor cranial nerve paralysis, weakness of neck flexor muscles, proximal limb muscles, and acute respiratory paralysis are seen due to prolonged cholinesterase inhibition and muscle necrosis. So this is seen a few times when person may after consumption after 1 to 4 days. So after 1 to 4 days, sometimes intermediate syndrome are seen with CNS manifestations are commonly seen like paralysis, motor neural paralysis, weakness of leg muscles, then acute respiratory paralysis are seen with muscle necrosis. It does not respond to oxyams and atropine since cholinesterase are irreversibly bound to organophosphorus compounds. So in that they usually the usual line of treatment doesn't work in intermediate syndrome. Delayed sequelae where the person survives, if the person survives, or he is not treated early, or if the even after mild, if the person consume for longer durations, mild small doses for longer duration, there may be some delayed sequelae after even the person is treated. In them, there is delayed peripheral neuropathy. It can occur with 5 weeks after exposure to certain compounds such as parathion, malathion, and trichloroethane. So, in this, even after person is treated, after 5 weeks, there may be peripheral neuropathy may be seen. It begins as paresthesia, pain, cramps in the calves followed by ataxia, weakness, and toe drop. It rapidly progresses to flaccid paralysis, which may ascend similar to Guillain-Barré syndrome. So it may look like a Guillain-Barré syndrome, which will ascend from one part to other part. Coming to fatal dose. So fatal dose of alkyl groups includes 15 milligrams IM or 100 milligrams orally. OMP is 80 milligrams, parathion is 80 milligrams, HTP is 60 milligrams, malathion and diazepam is 1 grams orally are fatal. Cause of death. Death usually occurs by paralysis of respiratory muscles, respiratory arrest due to failure of respiratory centers, or intense bronchoconstriction. So, mainly the nicotinic symptoms, nicotinic muscles symptoms includes respiratory muscles, CNS manifestation. So, bronchoconstriction is mainly the nicotinic symptom. Respiratory paralysis, muscle respiratory arrest, or CNS manifestations, and for that purpose, the person usually dies. So, common muscular symptoms are not cause death, but if the symptoms persist and the person has some nicotinic symptoms or serious manifestation, the person may lead to death. Late death, as long as 15 deaths occur because of ingestion, may be caused because of ventricular arrhythmias. So later, if the person dies, usually after 15 days, it is mainly because of cardiac symptoms of ventricular tachycardias, arrhythmias. Diagnosis. So first, if the person has some kerosene-like smell of consumption of any poison, so it should be assumed that person may be consumed organophosphorus compound. So diagnosis may be confirmed by giving 2 mg of atropine. In our person, this causes marked atropinization, but in case of poisoning by organophosphorus, symptoms are relieved with atropinizing. So atropinization is nothing but the dilatation of pupils. So if it is not seen, then it indicates that the person may have consumed organophosphorus compound. But confirmatory is mainly by estimation of cholinesterase enzyme in the blood or plasma. To do that, 5 ml of heparinized blood should be collected, and among them serum is separated. So serum and blood cells are separated, and both are tested for cholinesterase activity. So the average normal value for cholinesterase activity is 77 to 142 in red cells and 41 to 140 in the plasma. RBC cholinesterase level of less than 50% of normal indicate poison. So if less than 50% is like 20 to 70 is present, that indicates that there is chances that the person may have consumed organophosphorus compound. The plasma cholinesterase is more sensitive and will fall more rapidly and before red blood cells. So this plasma cholinesterase is useful for diagnosing chronic poisoning of OP compound because it will show more less in the plasma compared to red blood cells. Plasma value will approach normal in 7 to 10 days after the treatment is given. In untreated cases, plasma cholinesterase level may require 4 weeks to normalize. The cholinesterase motor nameplates can be demonstrated histochemically in muscle kept at room temperature. So in cases where the person is dead, so muscles should be preserved to estimate cholinesterase enzyme. So in among them, if the body is preserved at room temperature, it can be detected up to 1 to 2 days. If it is preserved at 4 to 6 degrees, it can be detected up to several months. Cholinesterase activity can be detected to confirm that person has consumed the organophosphorus compound. Treatment. The patient is removed from the source of exposure, that is contamination exposure should be removed. That is, clothes should be removed and exposed areas should be washed. Even ice, if the person has exposure to ice, should be washed with normal water. Other parts of the body should be washed with soap followed by ethanol and water. The airway should be kept patent. Tracheostomy may be required if there is respiratory distress is present. So respiratory distress is seen as manifestation in severe poisoning may occur. In that case, a tracheostomy should be done. Then afterwards, when the poison is ingested, stomach wash should be done with 1% 1 to 5,000 potassium permanganate solution. Later on, activated charcoal 1 gram per kg should be given. Ipecac should not be given since it is not recommended. A cataract, that is sorbate or magnesium catheter, can be given once unless diarrhea has occurred. Physostigmine, endorphin, and chloride or succinylcholine should be avoided and should not be given. After giving activated charcoal and stomach wash, once all the poison which is present in the stomach is removed, unabsorbed poison is removed, specific treatment of atropine is started. So atropine is the first line of management should be done. Atropine arrests the muscarinic effects of postganglionic parasympathetic symptoms, which are and also muscarinic receptors, and arrests the CNS effects. It has no effect on nicotinic action, so it mainly acts on the postganglionic parasympathetic as well as the CNS symptoms. But it doesn't have nicotinic symptom. It doesn't contract the nicotinic effects. It mainly acts on the muscarinic effect. It also prevents the CNS effects. So if the person has some CNS effect, it arises. So atropine is the first line of management which has to be done in organophosphorus poisoning. The dosage is 2 to 4 mg given IV as a test dose, and it is increased, has doubled every 15 minutes till atropinization is achieved. So till the pupil start dilatation, atropinization is done. The muscular symptoms are relieved. The dosage is continued. Afterwards, once adequate atropinization occurs, the dose should be adjusted to maintain the effect for at least 24 hours. So dose is adjusted, and to maintain the same level should be done. After atropine, specific cholinesterase reactivators are introduced. This includes diacetylmonoxime, also known as DAM, 2-pyridine aldoxime methoxide or paradoxime chloride, or pyridine aldoxime methane sulfate, act as a completing for phosphate moiety of the organophosphorus compound and release it from the organogenesis activity. So cholinesterase enzyme plus organophosphorus compounds which is adhered to that. So the paradoxime enzyme, paradoxime chloride usually acts on that, and it reactivates the cholinesterase enzyme to remove the acetylcholine and hydrolyzed acetylcholine. The adult dose is 1 to 2 grams IV, either as 5% solution given for 5 minutes or in 150 ml of saline and infused over half to 1 hour. Pyridoxine works synergistically and should be used together. So pyridoxine atropine has to be used. So only pyridoxine is not effective and only atropine is also not effective. Oxams reactivates the limited context, removes the block at neuromuscular junction, prevents formation of phosphate enzyme, and directly detoxifies organophosphates. So it reactivates the cholesterol enzyme which are completely added by the OP compounds, and it also directly removes the organophosphates. They are given until the patient is clinically well and not requiring atropine. Obidoxime is also one more compound which also reactivates cholesterol enzyme, which is more potent, but its toxicity is slightly greater than the PAM. Dose is about 250 mg IV or IM. It can be given if oxams are not available. H16 and H107 are compounds, newer compounds which appear have to have activity against all known organophosphates also available. Convergence can be controlled by giving IV diazepam 10 to 20 mg at rate of 5 ml per minute, 5 mg per minute, repeated if necessary after 30 to 60 minutes. Pulmonary edema and bronchospasms should be treated with oxygen intubation, atropine, and positive pressure in the ventilation. So mainly if there is nicotinic symptoms which causes the bronchospasms, in that cases the specific oxygen inhalation from antibiotics is mainly given to prevent pulmonary infection. So that is the general line of management of organophosphorus compounds. Coming to prophylaxis, to prevention of poisoning. So since, as I mentioned, the farmers who spray the organic compounds are the most susceptible group. They have to maintain some prevention methods to prevent poisoning. So protective clothing consists of white cotton overall, contains white cloth hood to cover the head and neck, rubber aprons, gloves, boots, eye shields, and respirators. This is one essential thing which has to be done by the farmers or anyone who sprays the insecticides. The face and hair should be thoroughly washed after spraying with soap and water. Not more than 2 hours of spraying a day should be done by a worker, and he should not work for more than 6 successive days or spraying. A person suffering from cold bronchitis should not be engaged in spraying operation. He has to avoid it. A worker should not smoke or chew or drink in spraying area. Spraying machines, tanks, containers, hoses should be thoroughly washed at the end of the work and before repairs are carried out. Since it can be observed from the skin, so any machine which comes and exposed to the organophosphorus compound should be thoroughly washed. Should stop spraying immediately if there is some kind of rash or person feels sick, there is eyesight trouble is present, sweating, feels unusually thirsty or heavy, if a person starts developing headache, then he should stop immediately and should be sent for hospital for further management. Come to PM appearance, postmortem appearance. Since the person cause of death is mainly because of respiratory arrest, so cause of asphyxia signs, asphyxia is the main mode of death and signs of asphyxia presents. The face is congested and there is cyanosis of lips, fingers and nose. So 3 main signs of asphyxia will be present commonly, which is any case of asphyxia death will be there. That is cyanosis, then there is petechial hemorrhages will be present, then congestion of organs. So these 3 signs will be present in any asphyxia, that is cyanosis, bilious discretion, petechial hemorrhages, the pinpoint hemorrhages, then congestion of organs will be present. Other than that, there will be blood stain, froth is seen at the mouth and nose. There will be smell of kerosene will be present. So smell of kerosene is mainly because of aromatics which is added in the organophosphorus compound. The mucosa of stomach is congested with some mucous petechial hemorrhages. Respiratory passages are congested and contain frothy hemorrhagic exudate. So again, respiratory passages will be congested because of increased secretions. The lung shows gross congestion, excessive edema and subpleural petechiae. The heart is sometimes soft and flabby. The internal organs are congested. The brain is congested, edematous, meninges are congested. So all organs are congested because of asphyxia. So sign of asphyxia, one sign of asphyxia, organs are congested. Petechial hemorrhages are present, again one sign of asphyxia. Coronary stress in erythrocytes and myoneural junction is below normal. So This atherosclerosis enzyme estimate should be done by taking samples of muscle tissue and to estimate cholesterol quantity. Organophosphorus can be detected even if the in putrefied body it can be seen. Coming to chronic poisoning, which is seen again in farmers who are exposed to the OP compounds in the large doses. It is seen in persons engaged in pesticide spraying of crops due to inhalation of skin and contamination. Symptoms includes weakness and anxiety, gait disorders, muscle cramps, paresthesias, drowsiness, confusion, irritability, psychiatric manifestations are seen. So since they are chronically exposed, the CNS effects are commonly seen. Person will be drowsy, irritable, anxiety, gait disorders will be seen. Coming to medical importance, so commonly accidental poisoning is commonly present mainly because in group who are exposed to manufacturing, packing the insecticides, spraying or dusting of insecticides. Children's of who have users who spray, they keep the OP compounds openly and the children may accidentally become poisoned. Some research workers may also get accidentally poisoned. Suicide is very common for organophosphor compounds, especially in India, where farmers usually commit suicide by organophosphor compounds. Homicide is rare because it's not pleasant to drink, so homicide is very rare. Hazards to consumers of sprayed coppers is very slight. So any compound which is sprayed by OP poisoning is very slight because it readily breaks down into non-toxic compound. So OP compounds are easily breakdowns. So any part of the object which is sprayed will not remain poisonous for longer duration. Poisoning usually occurs from continuous absorption, ingestion, and inhalation. Any claim of poisoning from sprayed atom is not which is very less likely. These are my references. Thank you.